This is the viscera of the diaphragm with parts of esophagus, pericardium, pleura and the peritoneum. The central tendon lies superiorly, true crura lies posteriorly. Right dome of the diaphragm is slightly higher than the left dome because of the presence of the liver on the right side. Diaphragm is a dome-shaped muscular aperitic partition because it is composed of both muscle and the tendon. It separates the thorax from the abdomen. It forms the roof of the abdomen. The summits of the convexities are known as the cupola. It has central part and the peripheral part. The central part is tendinous, which is known as the central tendon, and which give attachment to the fibrous pericardium and parietal layer of serous pericardium. Now the peripheral part is the muscular. It gives attachment, or it is covered by the diaphragmatic pleura, and inferior part or inferiorly it is covered by the peritoneum. As because diaphragm is a skeletal muscle, it has to have a origin, insertion, nerve supply and action. So what are the origins? First of all, its actually origins has three parts. Number one is the sternal part, number two costal and the vertebral. The sternal origins are by the two fascicle from the back of the G5 process. The costal origin is from the inner surface of the lower sixth rib and their costal cartilages, and the vertebral origins are actually arises by the means of the right and left crura of the diaphragm and the arcuate ligaments. So these are the right and left crus or crura. The right crus is longer and more muscular than the left crus because it arises from the anterior aspect of the body and the intervertebral disc of the upper three lumbar vertebrae. The left crus is smaller and it arises from the upper two lumbar vertebra body and the intervertebral disc. Now comes to the point of the nerve supply. For the nerve supply, we divide it into two parts, or nerve supply divided into two parts, motor supply and the sensory supply. The motor supply of the entire diaphragm is solely by the phrenic nerve, which is derived from the cervical 3, 4, 5. The sensory supply, for the sensory supply, the central part is supplied by the phrenic nerve and peripheral part is supplied by the lower 6 or 7 intercostal nerve. There are three major openings. Number one is the vena cava opening. This is vena cava opening. It lies actually 2.5 cm right to the midline, and it lies in the central tendon. This is central tendon. Now esophageal opening, it lies in the peripheral part or muscular part, and this is the aortic opening. The vena cava opening is quadrangular, esophageal opening is oval, and aortic opening is rounded. Vena cava opening, also known as the tendinous opening. This is muscular opening or esophageal opening muscular, and aortic opening is the osteoapnetic opening because posteriorly there is the bone, the vertebra, and anteriorly there is tendon. So that's why it is called osteoapnetic opening. Now vena cava opening. The vena cava opening, it lies anterior to the thoracic 8 vertebra. Again, vena cava opening thoracic 8, esophageal thoracic 10 vertebra, and aortic opening lies at the level of thoracic 12 vertebra. These are the characteristics of opening. Now the development. The central part is developed from the septum transversum. The posterior part between the esophageal opening and the aortic opening derived from the dorsal mesentery of the esophagus. The dome of the diaphragm is derived from the pleuroperitoneal membrane, and rest of the peripheral part is derived from the shelf-like projection of the body wall. Thank you very much.